Hey Transformers, this is day 5 of our 7-day Eliminate Stress Challenge. So today I want to show you another technique that will help your muscles, that will help you get a little more relaxed. All right. A couple of days ago, I showed you how to do some soft tissue work on your jaw. Today, I want to show you how to do soft tissue work yourself on an area of the body where we carry a lot of our stress, and that is on the neck. Now, this is especially helpful if you don't want to go to massage, you can't go to massage like now with the pandemic, or for any reason that you don't want or you can't get a massage or you can't get somebody to work on those muscles, you can do it on your own. So this is the best part of that. And all you need is a rubber bouncy ball like this, all right? Or a cane. And I'll show you how to use both, a cane or an umbrella, but as long as it has the curve handle. All right, so first is the rubber ball. What I want you to do is, I want you to palpate, this is the base of the skull, right? I want you to palpate around the area there, like along the cervical spine on both sides. Just do one side first. I want to show you. So let's palpate around the area, see which parts are harder or see which part actually is more painful. And I want you to go down up to your upper traps area and even in between your shoulder blades here, right? So from here, you go to the shoulder and to the shoulder blade, all right? Because that's the area where the muscles gets really tight, and that's the area where you usually will get nodules or taut bands. Those are muscle fibers clumped together and they cause pain. You want to release them to get your body to relax more and to relieve that pain. And this is especially helpful for people who they get headache, they get neck pains, or even upper back pains or mid back pains when they're under stress. So I want you to stand against a wall, use the rubber ball like this, and the spot, take note of the spot when you do the palpation earlier, take note of the spot that you have the pain on, or the spots. Most of the time it's gonna be multiple of them. So let's say, for example, this is the spot. I want you to just lean in. You can actually just step out a little bit to put more pressure, or step closer to the wall to put less pressure, depending on how sensitive or how tender that area is. And I want you to just lean in. So this is like doing a pressure point release. So the ball will serve as the pressure, and you lean in for half a minute to a minute, and then you relax. You're gonna notice during that period of time, the pain goes away, or the pain melts away. So that's what you want to observe, and that's what you want to feel. Then you move to the next area. For example, the upper traps, same thing. You go like this, and then you just lean in. If it hurts, that's okay. Hold it there, half a minute to a minute, and then you relax and you go to the next spot. Shoulder blade, same thing. Just make it lower, or if you can't, let's say, reach that area, you can push down and kind of come up and roll it to find that spot. Now, the other thing that you can do is you can have a few of these together, put them in a sock, and that will give you multiple pressure, like on different points. All right, now, aside from that, you can use a cane or an umbrella that have the curved handle. So what do? Let's say it's on the upper traps. Let's say this is the spot where I have the pain. I put it there and I just pull down. When you pull down, you're putting a pressure on it, okay? So you can do that, or if it's in the suboccipital area, in the cervical, paracervical area here, do the same thing. I'll just put it in that spot and then kind of pull forward. Okay, shoulder blade around, the same thing. You put it under your armpit because it's more towards the mid back, like this, and then you pull it forward. Put some pressure there. Okay, so either one of them, whichever is more comfortable, will work very well. So it's up to you. You see what you have, see what you're more comfortable with, and pick one that's more effective for you. And I want you to try that. So go and try it now. Let me know how you feel. Let me know how you like it. And I would love to hear your comments below. All right? So I'll see you on the next video.